Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
A significant concern that exists within the dental profession is in the area of patient education. We're going to be presenting today a model, a four-stage model for patient education. The first stage in our model deals with establishing a personal relationship with the patient. The second stage in our model deals with the patient's commitment to their own oral health goals. Third is the information and training provided by the professional staff so that the patient can move toward their desired goals. And fourth is the dentist holding the patient responsible for achieving the desired behaviors. We're going to be visiting several private practices today to see how this model is carried out in private practice. Let's first see the establishing of the patient relationship.
When was your last dental visit, Carol?
It's probably, I think, around last November or December.
Okay, did you have a cleaning at that time?
No. Mm-mm.
Okay. When was your last prophylaxis?
It's been about a year and a half.
Okay. And do you have any bleeding when you brush at all now?
No, not at all.
None at all. Okay. And do you use a hard or a soft brush?
I use a hard brush.
Okay. Carol, do you smoke at all?
No.
Okay, very good. And you have marked on here that you do have drug allergies, and also that you are taking Coumadin. Do you find this any problem at all in your dental visits?
No. The only thing, if I'm on too much Coumadin, I taste blood. But that's all. But
Okay.
It's not from my gums.
Okay.
It's from the Coumadin.
Okay. Do either one of your parents have dentures?
Yes, they both do.
And how do you feel about dentures?
I'd like to avoid them if I could.
I'd like to avoid
Because they had them at an early age. My mother did.
Okay, and how old was your mother?
She was 30 when she had them.
Do you remember them mentioning anything about whether possibly she had pyorrhea or a gum disease when she lost her teeth?
They just said she had very soft teeth, and they just, decayed very easily.
Mm-hmm. Okay, and how about your husband? Does he have his own teeth? Does he have dentures?
He has his own teeth. Yeah.
Okay. And I'm sure that he very much wants to keep his own teeth. Yes,
they're in good.
I do know.
In good shape.
Do you have any feelings about your past dental experiences? Have you ever had any bad experiences? Feelings that have kind of made you a little apprehensive about coming to the dentist, or?
Well, it seems like every time I go, we mess around for maybe 2 or 3 visits, and then they decide to pull a teeth. Or else I've been through this root canal business twice, and then he still pulled the tooth that he worked on. So it just seems like I'm going forever and ever and ever, and they're working on the same thing.
I see.
So
do you have any apprehensions about being in the chair at all?
I don't, unless they don't tell me what's going on.
I see.
If they tell me what they're going to do, it's better for me.
In other words, you very much like to be informed of what we're going to be doing.
Especially when they numb the gums. It does frighten me a little bit if I don't know they're going to stick the needle in there. And it does scare me a little bit.
Okay, that's very good. Do you have any questions about any of the things that we do here, any of the policies that we have, or anything about our office that you've discovered so far that you'd like to ask?
No, I don't believe so.
Okay. I will just mention that probably what Dr. Murray will be doing is suggesting that you have a complete examination. This is the only way that we can really get a very good understanding of our patient and our patient's dental situation. And he will explain to you that this is a series of x-rays and models of the teeth and a Polaroid picture, blood pressure reading, health history, many things that we really feel that we do need in order to do a complete examination. But he will be talking to you first today and checking you visibly, and then I'm sure he'll make a recommendation after that. Okay?
Okay.
All right, I'll go get Dr. Murray now and be right back.
Okay.
The process of establishing a personal relationship has begun with a history taken. The patient has been allowed to express her concerns and some of the anxieties that she has concerning dental treatment. This relationship will continue as Dr. Murray begins.
What we're going to do today is to examine your mouth and to sit down with you and make some general recommendations. And then, because of some of the problems that are present that we've seen in the x-rays, at your next appointment I'll be able to make some very specific recommendations. But today we'll be able to give you some pretty general recommendations and ideas of what we would like to treat and things we'd like to achieve. First concern is going to be to try and eliminate new problems starting in the future. And then we can always go back and say, all right, what's the best thing we can do possibly to restore the teeth that have been lost?
Dr. Murray continues to establish a personal relationship of involvement with the patient through reviewing the history and the oral examination, as he builds in the mind of the patient a responsibility for her own personal oral health.
Carol, what type of a toothbrush do you use normally?
Hard toothbrush.
Hard brush. Any particular direction, or do you just...
Up and down.
Okay, up and down. I can tell from looking in your mouth you're a very thorough and conscientious brusher.
Okay.
And sometimes as a result of this, and I can perhaps show you on our models here, we can cause some problems. Some of this problem might be the recession of this gum tissue, and in some areas your brushing may just have been so vigorous that it has caused some problems by forcing the gum tissues, and as a result the bone underneath here to recede back. Mm-hmm. So one of the things we'll talk about will be the home care.
With the establishing of the personal relationship begun, the oral examination is continued with study models, charting of teeth, and radiographs. We move then to our second step in our patient education process, which is the patient's commitment to their own oral health goals. In this particular practice, that segment is focused on the case presentation.
We have several concerns here. One is with the gum tissues. If we are going to embark on a long-range plan, it's important that we arrest this gum irritation that we have present and the new decay that we have. We've got to find a way to stop this problem. The most effective way to do it is to have a home care program of brushing and flossing that removes the cause of both the gum problem and also the tooth decay problem. So one of the first things we'll be doing will be to spend a little time with you in reviewing effective brushing and flossing. Now, you've been doing the job. You've been in there working like mad.
Too much. Huh?
And too much, and we've caused a little bit of a problem. And these are the areas that I was mentioning when I showed it to you in the mouth. We have this recession because usually, are you right-handed?
Right-handed, yes.
Usually the right-handed patients will be the ones that will be most aggressive because they get the leverage and they can scrub on that left side. That's what's happened up on this side here. So we will be interested in arresting that problem and arresting the problem of new decay starting between teeth. These are these dark areas here. This concerns, this is where you mentioned the food packs on that lower, gets into the lower right. We have a couple of decayed areas down there, quite large. And it is a food trap now, and we want to be sure that when we're through treating this, we have these maintained so that you can brush and floss all the areas between the teeth and we don't catch any of the fillings. I don't know if you had that experience before of ever catching or tearing the dental floss, but we want to make sure that you can cleanse these areas between the teeth. So our major concern, our first recommendation will be to get the gum tissues healthy and get a home care program going that will arrest future problems.
The patient's commitment to their own oral health goals in relationship to their oral hygiene is continued in the case presentation. Such items as types of care that will be provided, such as periodontal work or crown and bridge work or restoration of caries lesions, is laid out to the patient along with the financial arrangements and how much time is required for the completion of this treatment. Patient responsibility for their own oral health seems to be a very difficult problem in private practice. We asked Dr. Murray why it seems to be so successful in his.
But by the time you get through this examination procedure, they can pretty much tell you, man, that's one of the first things that's going to be done. During the visual examination, we identify the problems in the order of their importance, and almost every time it's the soft tissue health and what our recommendations are going to be to solve that problem. So they know that's my first problem, the soft tissue gums. My gums are bad. That's the first problem. They're not going to do anything until we solve that problem. So they figure, well, where's the gum problem? Well, we list that first because that comes first. And then we don't proceed with other treatment until we get through that phase of it.
With the patient committed to their own oral health goals, we move on to number 3 in our patient education model. That is the information and training provided by the dentist to carry out these specific goals. In this segment, we have a 3-part item. Number 1 is desired behavior is clearly identified. This can be done by providing information to the patient and modeling, showing the patient what they are expected to do. Number 2, we shape the patient's behavior in small incremental steps. We do this through directed practice and giving feedback to the patient, showing the patient where they're making mistakes or where they are successful. Number 3, reinforcement of any movement toward the desired behavior. We can see this procedure begin in another of the offices that we've visited.
Well, good afternoon, Kathy. Thank you for coming in. And today is the day I'm going to keep the promise that I made to you in the conference time. Because if you recall, I said when we mentioned about the decay that you were having and about the mild infection, the plaque that was around in the gums, and I said that there was something that you could do to prevent and take care of this and actually keep the teeth that you have for the rest of your life. Because the goal in this office is that you are able to keep all of your natural teeth for your lifetime. The essence of the program is that we all should clean our teeth, and certainly we all do that. And you have been brushing your teeth and cleaning your teeth, and as you use the brush, and it really doesn't matter in which way you brush, although many people just prefer to brush this way, but what you do is clean the outside surfaces of the teeth. And really, you do a very good job of cleaning these areas on the outside surfaces. In fact, most people do, and very few people ever get cavities there. Fewer people clean the inside areas down in here, and even fewer people clean between the teeth. Now, the concept here is that the bacterial plaque causes the disease, and that the bacterial plaque forms daily on your teeth, first in just a tiny film, just a precipitate or a film from the saliva covers the teeth, and then very gradually in a period of minutes, really, or in a period of hours, the plaque begins to build up until at the end of the day it almost feels like a fuzzy feeling or a little fur coating on the teeth. Well, this is the plaque. And now you can see if you just brush your teeth like that, your teeth are going to feel a lot better because your tongue won't be able to reach the fur covering, but still you haven't cleaned in between the teeth. So what I'm really saying to you is this: the secret of keeping your teeth for a lifetime and the secret of keeping your mouth free of dental problems is not to brush your teeth, like we've always said, but it is to keep your teeth clean. And you've got to think in terms of cleaning the areas that the normal toothbrush doesn't get, like down inside here. Do you notice how there's a little space here where the tooth is separated? We call that the tooth collar, or the collar, like a shirt collar around the tooth. You have to clean down inside there, and the other area is to clean right in between where the teeth touch, because that contact point is tight like that, and there is no way in the world a toothbrush bristle can ever fit inside. So let me show you. If you'd hold that mirror, I'd like to show you these places in your own mouth.
At this point, information is being provided by the dentist to use as a basis for developing the desired behaviors. The dentist is providing authority to set the stage, which will later be carried out by all of the professional team. On additional visits, the process continues, and modeling will be provided so that the patient's behavior will be shaped in the desired manner.
Now, I'm going to take the toothbrush and just go through and brush your teeth like you would do at home, all right? With the same pressure and getting those bristles down into the gum line, but very gently. What you're doing is massaging the gum. Going around, starting at one side, then to the other. Going down very gently. Very good.
The dental assistant continues to identify desired behaviors by specifying criteria by which the patient can measure his or her success, such things as bleeding gums or proper flossing techniques.
Okay, let's stop here and take a look for any bleeding areas, because bleeding is a sign of infection. Okay, see the blood there? All right. Hold it just like that. And that way you can see how I'm going to floss so that you can do it when I'm done. And I can watch you and help you with any problems. Okay, go down very gently, wrap around, and pull up. Seesaw down very gently, wrap, and pull up. The scraping action is what actually takes the sticky plaque off the tooth, okay? Since plaque is bugs, they attach to the tooth.
The dental assistant records present deficiencies on a chart to record progress made toward the desired behavior.
So we'll mark those things down. What I'm going to do is mark down here in red stain where I saw the stain. We'll put just a general line down at the gum line, okay? Which means you should get your brush down a little bit further, and I'll practice that with you. And then also on the bottom on the inside. And then for the bleeding areas, I'll circle it. We have bleeding here, and back here. Okay?
Yeah.
In step 2, directed practice and feedback occurs. However, all 3 of these steps are closely related. We see that shaping is beginning to occur. Shaping includes things such as modeling, directed practice, and also feedback.
When you floss your teeth, take a piece of floss about as long as that is. Wind it around your middle finger on one end. Right. And then the other middle finger on the other end. Right. Put most of it on one finger, okay?
Okay.
If you understand what I mean. Now, the reason for this is that when you are flossing, the floss will get frayed or, broken or dirty. This way you can unwind it and always have a clean piece to use.
Okay.
Okay? Now, you're going to floss with your index fingers or your thumbs or one of each. This is to help you reach your back teeth so that you don't have to get your whole hand in your mouth. All you have to get back there is 2 fingers, okay? It'll be much easier that way.
What I'd like to do before we go further is to have you try these 2 things, because this is the basic, or this is the essence of the program. I'd like to just have you try this brush and just put it now in your, here, let me hold it. And work the bristle, just the tip of the bristle. Good, very good. Just very gently insert it up under the gum and just vibrate. You can go a little hot. That's very excellent. You've got very good technique.
Feels new.
Good. I can't believe, boy, you're exceptional, because most people don't pick it up this quickly. It's very good. How about on the inside now? Reverse and go. Because that's just important to clean on the inside as it is on the outside. Excellent, excellent. That's good. All I wanted you to do is just get the feeling of it, so that you don't have a question.
Step 3 deals with reinforcement, which is a continuous process. It can take many forms, including verbal praise.
That's good. That's very good. Now let your thumbs go, because you can. That's it. That's good. Now one finger on the inside. Can you see? And wrap it. Now go gently between. Carry it down. That's good. Till it's at the bottom. Now apply pressure and come up. Very good. You know, the fact that you are an artisan shows, because you have very good technique with your. Excellent. You won't have any trouble with this at all. That's beautiful. That's very good. That's very good. What I really want you to do is to just kind of practice with it. And as I say, I think that what we do recommend at first is that you find a time and sit down in front of television or something and spend maybe half an hour, 45 minutes. It may take that to learn where to put the fingers and get them all around. Now, when you come back, we will evaluate you again to see how you're doing and make suggestions and recommendations so that it can become second nature.
Okay. Now, what I'm going to do is have you demonstrate to me, okay? Here's the brush. I'll hold it just so you can see it. Okay, show me how you brush it at home. Okay, can I make a suggestion to you?
Yeah.
Okay. Take the bristles and kind of slide them up underneath the tooth, because there's a collar underneath the gum line that you want to get clean.
Okay.
Let me help you guide it up. There you go. And just kind of jiggle. Super.
Shaping focuses in more specific as the desired behavior develops.
That's great. Okay, get a piece that's about this big. All right, that's right. Now use these as like a tightrope. You might need one strand off. Okay, but tuck that underneath. Now use it like, there you go. You can use this thumb too. Now go to the lower of the mouth. Put one hand inside, open, and one hand out. Okay, very gently wrap around the tooth and pull up. Go down, seesaw down very gently. Okay, wrap around, bring this finger in the inside around. Very good.
The patient's responsibility carries out of the office into the home.
Slide down, pull apart. Okay, I think you've got the idea of it. I'd like you to go home and practice it. All right? Then I'd like to see you again in about a week, and we'll practice it again.
The 3 steps in the learning procedure have now been demonstrated. The desired behavior has been clearly identified. Shaping and reinforcement of this desired behavior has occurred. These steps may be carried out in a variety of different ways. I asked Jan Baker how a patient goes through their patient education program.
He will come in and we will review brushing again on the second appointment, and I will give him flossing instructions at that appointment. We send the brush, the floss, everything that we give him to use, we send home with him at the end of his appointment, because we feel that they're going to go home and work with the technique, regardless whether we send the right stuff home with him or not. So it's very important that we do. I also have a little folder that I send home with him that explains it very thoroughly, so if he runs into any problems, he may do so. The second appointment, he basically learns the technique of flossing. The third appointment, by then he has pretty much mastered the technique, and he is either fumbling and we have to figure out why, or he's still missing and we have to figure out why, this type of thing. But it's a basic awareness each time for the patient to have him look in his own mouth and decipher where he is missing and where he's not. The fourth appointment is pretty much just what we call a test time, where he does his brushing and flossing, his complete plaque removal here in the office, and I do not watch or observe him at that time. And then I go in when he is finished and I do a plaque check, and the doctor will check him that day to see a tissue response and so forth.
How does that seem to work when the patient comes in and brushes in here?
Works beautifully.
Evaluation of the patient's progress is the critical 4th stage in the patient education process. Here, the dentist holds the patient responsible for movement toward his own oral health goals.
Now, we're going to be checking you when you come back here, just during a regular visit, and until you become proficient, until you can brush adequately everywhere, until you can floss, and that there's no stain left on the teeth, or at least stain on less than 5 teeth. We don't want any bleeding, and we don't want any odor.
Keeping a patient accountable for his own oral health behavior is a difficult task. Many times there's no reinforcement in the home. I asked Dr. Marcotte how he ensures that the patient is held responsible for his own oral health.
We have what we call a recall core. In other words, when a patient comes in for their recall visit, my assistants evaluate them to see what kind of job they're doing in their home care. And we use this type of a chart here to list this, and the way this is, every time they come in, there's a separate square for each time. And when they come in, the first thing that the evaluator does is to look for the general effectiveness of the mouth, to see if there's any areas of dense plaque accumulation and gross swelling. And then she gives the patient a general brief summary. Gee, things look good, or they don't look. Gee, maybe we could use a little help, or just a general brief summary. She then begins to record on this chart the things she finds. Second thing she does is to stain the mouth. And then she records, again, generally, areas where stain is present. Without saying too much to the patient, we don't want to turn the patient off. The most important thing here is not to say anything negative, to make it all positive. And if you do have to say something negative, try to say someone else did it. In other words, this isn't you, and it's not your teeth, but gee, oftentimes we see people whose teeth look, with a lot of stain, and they can say, oh my God, that's me. But we want to record the amount of stain, and then we go through with the toothbrush, and we brush each tooth carefully using an intersulcular kind of scrubbing method. And here we're looking for bleeding, because this is our other criterion, is bleeding and stain, and then of course odors is the last one. I'll come to that in a minute. So they record then any areas of bleeding with a red circle, as you see here. And then they go through and they floss the patient's teeth. And again, we're looking for bleeding, we're looking for floss tear areas, we're looking for odor. We want to bring these home to the patient as this is our criterion for the patient doing a good job. Now, this is what you'll be seeing today as my assistants are doing this. What we've generated to this point is a written documentation of how this patient is performing as of this day. And then when I come in to do the periodic examination, and when I check for periodontal pockets, and I do an occlusal check just to check the occlusal relationships, I have a quick summary as to how this patient's doing. Then it's my job to say, Charlie, you got to get going. Or else to say, Mrs. George, you're doing a super job. It's my determination when to apply the pressure. Barb, how'd she do?
She did pretty good. There was a little bit of bleeding down on the bottom. Okay.
Pardon me. Very good. I see what you're talking about, just a bit. Gene, it looks like things are better, generally. And in looking back over the past history, over the time, you've done very much better today than in the past. And it looks as if you've got this disease problem, which of course everybody has. Everybody has. I'm talking about tooth decay, I'm talking about periodontal disease, I'm talking about the things that this bacterial plaque will lead to if it's left unattended. And consequently, by removing the plaque, such as you're doing, you can keep this problem from ever really occurring.
We have presented a 4-stage model for patient education. The steps in this stage are, number 1, establishing a personal relationship of involvement with the patient. Number 2, the patient's commitment to their own oral health goals. Number 3, information and training provided by the professional staff to carry out these desired behaviors. 4th, the dentist holding the patient responsible for achieving the desired behaviors. Many dental practices are built on this process of patient education. What you have seen is this 4-stage model working in successful practices.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.